BSc or BSc. So we are every registered medical practitioner comes across with a case of poisoning. So when a patient presents with the suspected poisoning, a registered medical practitioner has a critical role to play in ensuring prompt and appropriate care. From the initial assessment and stabilization to the collection and preservation of evidence, the duties of a practitioner are multifaceted and crucial in the management of medical emergency and medical emergency effectively. See, as we have studied this medical jurisprudence right from the second prof and BBS, so we have studied about duties of a doctor towards his professional colleagues, duties towards the state, duties towards the patient, that is called as doctor-patient relationship, doctor-doctor relationship, and doctor-state relationship. So similar is the case when we examine a case of poisoning or any medical legal case. So we have duties towards that patient. Firstly, our utmost priority should be to revive the patient, to save the life of the patient, and simultaneously we have to be careful about our medical legal duties, our legal duties like duties towards the law enforcement agencies and duties towards the state. So importance of prompt medical intervention. The very first is rapid response. Time is the essence in case of poisoning. Prompt medical intervention can mean the difference between life and death, as many toxic substances can quickly become life-threatening if left untreated. So the very first, utmost importance is we have to revive the patient and decontaminate the patient or manage the patient before looking for any legal aspect of that. Minimizing absorption, you better know quick action to limit the absorption of the poisonous substance, such as inducing vomiting or administering activated charcoal or any other universal antidote, can significantly improve the patient's chances of survival and recovery. And antidote administration, certain poisons have specific antidotes. So if you know the nature of the poison, you can administer that antidote, provided that the availability of that antidote at your workplace. That's very rare, but you nothing, at least you can prepare a universal antidote, so you can use that. Certain poisons have specific antidotes that must be administered in a timely manner to counteract the toxic effects. Delaying in this critical step can lead to irreversible damage or even death of the person. Initial assessment and stabilization. Airway, breathing and circulation, you better know that every clinician, every registered medical practitioner is well versed with that, what is ABC. So the first priority is to ensure the patient's vital signs are stable with a focus on maintaining open airways, adequate breathing and proper circulation. So if there's a patient of poisoning with some frothing over his mouth and nostrils, so at least you can do a bit of suction if you have something. So you have to maintain airways and ABC of this vitals. You have to look for that. The very first thing to do. Then decontamination. If the patient has been exposed to a toxic substance, the skin and the eyes may require immediate decontamination to prevent further absorption and limit the damage. So you can use normal saline or tap water to decontaminate the skin or eyes or any superficial part of the body exposed. Then the supporting care is providing supporting care such as administering fluids, managing pain, and monitoring the patient's condition is crucial in the initial stages of treatment. Supporting care means symptomatic treatment. Like we have to maintain the pulse, blood pressure, and if required, inotropic support or something like that. Identification of the type of poisoning. Clinical presentation. Carefully observing patient symptoms and signs can provide valuable clues about the type of poisoning, helping guide the subsequent steps in the diagnosis and treatment. So, see, history taking is important everywhere, whether you are doing some autopsy, whether you are examining an MLC, like a case of poisoning, a case of sexual assault, a case of anything. I mean, history taking is important everywhere.